Opioids, including prescription painkillers and heroin, killed more than 28,000 people in 2014, more than any year on record, with at least half of all opioid overdoses involving a prescription drug. Those figures a big impetus for President Barack Obama to try to tackle this issue, a topic he and the U.S. Surgeon General spoke about today.
Since the turn of the century, opioid prescriptions have skyrocketed. And we have currently nearly 250 million prescriptions for opioids written every year. That's enough for every adult in America to have a bottle of pills and then some.
The president said his administration would provide about $100 million specifically for community health centers so people have more access to treatment, as well as...
We have proposed in our budget an additional $1 billion for drug treatment programs in counties all across the country. And the problem we have right now is that treatment is greatly underfunded.
Another $11 million would go to states to buy and distribute naloxone, a drug that could reverse the effects of overdose. The Centers for Disease Control and Prevention recently released new guidelines recommended for physicians who prescribe these powerful painkillers. The recommendations include when to take opioids for chronic pain, selecting appropriate dosage, and assessing the risk and harm in opioid use. The CDC told us that these guidelines are not mandated, meaning they're not laws, but rather a tool for primary care providers to use for reference. A recent survey also revealed a spike in premature deaths in many rural counties across the country, in part fueled by drug overdose deaths. The issue has major socio-political and economic ramifications, costing the United States upwards of $55 billion, much of that attributable to loss of workplace productivity. Some hospitals have taken matters into their own hands as well, trying to cut down on opioid use even in the emergency room.
Pain management is very different in the hospital setting. Using a cocktail of medications, they will try to minimize the amount of opioid that a patient gets, thereby trying to prevent further addiction once they get out of the hospital setting. The problem with transferring that type of resourcefulness to the outpatient setting is that you just can't inject all these drugs into people who are walking around, and you need to give them some simple medication that they themselves could take every day.
Dina Gosofsky, CNBC Business News.